Thanks for joining us as we near the end of our ECHO series on innovations in cardiovascular prevention. Reminder not to disclose any PHI. I think we've been pretty good about that during this series. This morning, we have two presentations from Brittany and Kevin, and Danette is going to give us a very interesting presentation on mental health issues as they relate to cardiovascular prevention, but also more broadly. And I'll discuss the two cases along with Dr. Werner this morning. Again, reminders about assistance. You can contact Rick for IT support. You can contact me or Claire for any other issues. And these are our disclosure statements, which have not changed since last week. Again, once again, a reminder about patient-centered language recommendations. You can read these on your own. I haven't heard any violations of these guidelines so far in this series that I can recall. Okay, Danette, the floor is yours. Please take it away.
Good morning. Different topics. Next slide, please. So for the first set of slides, I'm going to describe the relationship between anxiety, depression, and body weight. And the second set of slides, I'll describe our understanding of psychological causes of obesity, but the focus will be on perimenopausal and menopausal women. And then the last set of slides, I'll describe 3 randomized clinical trials for weight management for patients diagnosed with severe mental illness. These studies on these next couple of slides focus on like body image and appearance. So body image, it actually refers to a person's perceptions and attitudes, including feelings, thoughts, and behaviors regarding their own body and appearance. An appearance evaluation describes the subjective, either positive or negative evaluation of one's physical appearance. So some studies show that as appearance satisfaction decreases, that depressive symptoms significantly increase for women compared to men. And studies also show that as positive body image decreases, depressive symptoms increase in women and men. And as body mass index increases, the satisfaction with appearance decreases. There's also a study that showed that men reported fewer depressive symptoms than women and higher satisfaction with appearance compared to women. Next slide, please. Studies also show that there were mediations found in women, in men, but not women. So some studies show that the appearance evaluation is actually the mediator of the association between body mass index and depressive symptoms. Next slide, please. And so these studies on this slide, or the study on this slide, focuses on weight perception. And weight perception was defined as the perception of being fat. So results from this particular study showed that obesity and the perception of being fat significantly increased the likelihood of depression, and that the association between obesity and depression was mediated by weight perception. Next slide, please. And the mediation also occurred in participants who had partners, who were non-smokers, non-alcohol abusers, and participants who did not engage in physical activity. And in several studies, there's also evidence that the higher the body mass index, the greater the probability of experiencing depression. Next slide. So these next couple of slides focuses on social anxiety and obesity. And appearance-based social anxiety is the tension and anxiety one experiences when others evaluate him or her in terms of physical appearance. And the association between BMI and appearance-based social anxiety is mediated by body dissatisfaction. But I'd kind of like to point out there's a little bit of a difference between, an important difference between the anxiety and depression. With social anxiety, the person is going to be focused on how others evaluate him or her. And the depression, regarding appearance and body image is how the person evaluates him or herself. So when it comes to if someone has, problems with their body appearance, or they evaluate their appearance negatively, is recommended to provide interventions to actually improve their body image perceptions. Next slide, please. So just generally speaking on this slide, if someone has irregular eating habits, studies have found that they're associated with depression and anxiety, body dissatisfaction, distorted body image perception, unhealthy weight loss methods, and diet history. And also anxiety disorders are often comorbid with eating disorders. There was an older study or survey in 2004 that found that 2/3 of people with eating disorders suffer from an anxiety disorder at some point in their lives. And persons in the obese category overall tend to have higher rates of social anxiety compared to the general population. So this next set of slides is going to focus on peri and postmenopausal women. And actually, this is an area that's near and dear to me because I do research in peri and postmenopause. But in the United States, more than 63 million women are over 50 years old. And natural menopause is defined as the permanent cessation of menstruation. So there's, no more menstrual cycles. And actually, there should be 12 consecutive missed cycles. And this is a result of losing ovarian follicular activity. Next slide, please. So the average age of menopause is 51, but many women go through natural menopause or surgical menopause way too early. And actually 5% of women, 40 to 45, experience early menopause. So the transition into menopause, not always, but often accompanied by hot flashes, night sweats, trouble sleeping, memory difficulties, weight gain, mood changes, and vaginal dryness. Next slide, please. So these next couple of slides, I'm going to just share with you some factors that lead to weight gain in menopausal women based on a 2022 focus group study in New Delhi, India. So the following factors led to weight gain in this group of peri and postmenopausal women: daily psychological stressors, fatigue, reduced activity levels, overeating, prioritizing other needs over their own self-care needs. Next slide. Emotional eating, difficulty managing exercise and healthy dietary habits, particularly if women continue to engage in their religious and cultural food practices. Um, Confinement during COVID-19, stress and lack of time. And in this focus group study, it also showed that women observed that their peers gain weight during this life phase, and that there was a drastic weight gain in the abdomen, the thighs, and the hip areas. Next slide, please. So other perceived factors leading to weight gain for perimenopausal women were cravings around their menstrual cycles, reduced physical activity if their menstrual flow was heavy, and increased consumption of foods higher in fats, salt, and sugar around their menstrual cycle. And also in this age range, and I know this is not limited to this age range. If they have medical conditions that lead to physical limitations, they obviously are going to have reduced activities. Um, so motivations for weight loss would be seeing results from any efforts put forth, wanting to improve their appearance, or preventing health-related issues. Next slide, please. So a survey of Latin American women. So there was 6,079 women aged 40 to 50 years old who were surveyed from Latin American countries. And the result from logistic regression: sedentary women were more likely to have more severe menopause symptoms, more depressive and anxious symptoms, problems with insomnia, increased waist circumference, increased prevalence of obesity, and increased prevalence of hypertension. And in this survey, it showed that a stable partner, use of hormone therapy, and higher education levels were found to be negatively associated with sedentary lifestyle habits. Next slide, please. So just some general information about menopausal women. And this is where, I think that emphasis should be put on, is that the prevalence of obesity and metabolic syndrome is 3 times higher in menopausal versus pre and perimenopausal women. And obesity seems to be related actually more to lifestyle and age than menopause itself. But activity levels decrease with advancing age and mental health disorders. And depression, in particular, impacts activity levels and nutritional intake. Next slide, please. The duration of sleep reduces in the menopausal years, which also can lead to weight gain and changes in fat mass. Lean body mass tends to decrease with age and body composition, and fat distribution changes significantly during menopause, which really is distressing to women with increased abdominal and visceral fat. Um, so these next set of slides it's an overview of 3 randomized clinical trials for weight management for the severely mentally ill population. And the first one was conducted in England, the stepwise study, and the last 2, the Achieve and Stride studies, were conducted in the United States. So the stepwise study was a 12-month study and based on the behavior change theory, and the focus was on food and physical activity, psychological processes underlying weight management, and challenges of living with psychosis and its impact on eating and weight. So the intervention included weekly group sessions that were actually 4 consecutive weekly group sessions that were 2.5 hours long. And then that was followed by maintenance sessions at months 4, 7, and 10. The study also included one-to-one support contact for 10 minutes every 2 weeks after the intervention period. So the diagnoses in this for the participants in the study included schizophrenia, schizoaffective, and first episode psychosis, and the identified race or ethnicities included white European, Asian, Black, mixed, or other. Next slide, please. So the session content for the first session, the focus was on healthier drinks. The second session was on healthier snacks and physical activity, followed by calories and portions and sedentary behaviors. The fourth session focused on the challenges of eating out and the solutions for these challenges and making choices. And then sessions 5, 6, and 7 were booster sessions to help participants to stick with the program. So what the study showed, the results were about a half a pound weight loss between study intervention and the treatment as usual groups. And the schizoaffective group achieved the largest weight reduction of 2.7 pounds. Next slide. So this study was considered unsuccessful. Um, and it was thought that there was not enough attention on mental health challenges and medication management. And for those who lost weight, the findings suggested that monitoring and regular feedback from facilitators helped them to succeed. However, that was not really a part of the stepwise intervention. And participants actually wanted the intervention to be longer than 10 months. Next slide, please. So the Achieve program, it was an 18-month intervention. It focused on the social cognitive and behavioral management theories. And these theories actually followed the principles of skill building and environmental support. Um, in this program, there were lifestyle interventions that were shown to be effective in the general population, and it also addressed deficits in memory and executive functioning. And having worked with severe mentally ill patients myself, I think this was a really good intervention here because it divided information into small components and it actually kept repeating targeted skills. Next slide, please. So the intervention included group weight management, individual weight management, and group exercises. The participants were diagnosed with schizophrenia, schizoaffective disorder, bipolar disorder, major depression, and other. And the self-identified either race or ethnicity included white, Black, Hispanic, or other. Next slide. So this little busy slide here, if you look on the left, these were the sessions that were offered for group weight management, individual weight management, and group exercises. And on the right-hand side, those were the number of sessions attended. So if you just kind of like just scan over this slide, you can see there was a lot of sessions that were actually offered and also attended. Next slide, please. So the results from this study, the primary outcomes were changes in weight from randomization to 6 months and 18 months. And so the mean net weight change, which was defined as the change in weight in the intervention group minus the change in weight in the control group at 6 months. So at 6 months, it was actually the intervention group lost 3.3 more pounds than the control group. And at 18 months, the net change was 7.5 pounds more lost than the control group. And 5%, at least 5% of participants in the intervention group, I'm sorry, I apologize, 37.8% of participants in the intervention group lost at least 5% of their baseline weight compared to 22.7% in the control group. Next slide, please. So the last randomized clinical trial was a 12-month intervention, and it included 2-hour weekly group sessions over 6 months. And within that 2 hours included 20 minutes of physical activity, and the 6 months was followed by an additional 6 monthly maintenance sessions. So the interventions included a lot of education about how to record food, beverages, and calories consumed. Um, Also education about what are the recommended servings of fruits, vegetables, and low-fat dairy products. Education about, how much fiber and fat to intake, and also showed participants how to record exercise and sleep. Next slide, please. So the participants are also encouraged to engage in 25 minutes or more of moderate daily physical activity. And then they also were showed how to use monitoring records. And what I think was also really interesting about this study is that participants and interventionists, they reviewed these records and evaluated and modified their goals and plans. Participants were also given a calorie king book, and they were also given a resistance band to encourage strength training. Next slide, please. So the participants were diagnosed on the schizophrenia spectrum, diagnosed with bipolar or affective psychosis, with only 2 participants diagnosed with post-traumatic stress disorder. And the participants in this group identified their race or ethnicity as white, non-white, or Hispanic. Next slide, please. And the results showed that the intervention group lost 9.7 pounds more than control participants from baseline to 6 months. And the intervention group lost 5.7 pounds more than controls from baseline to 12 months. In addition to that, the intervention group, their glucose levels decreased at 12 months, and the control group, their fasting glucose levels increased at 12 months. And so basically, I think with these randomized clinical trials, you can see that in order for the outcomes to be successful, there's a multidisciplinary team, which I don't think is, unfamiliar to us. And there's actually quite a bit of work involved. So thank you for your attention today. And any questions?
Thank you, Danette. Any questions for Danette before we move on? So I had one. I'm sorry, did someone have a question? So Danette, I had one question, and in these sort of controlled situations with postmenopausal women, we're seeing still very modest amounts of weight loss, if at all. And you think about the resources that have to be invested. What recommendations would you make for those of us on the front line? Because this is a question I often get asked, because I've always had more resources to help people achieve a healthier weight than most primary care physicians. But how would you approach it when those aren't available, when there is no multidisciplinary team, for example?
Education. So women can feel that their problems and their struggles with weight is normal, and let them know why they're having so many changes in their body, because a lot of women have no idea. They don't understand, about the hormonal changes and how that will change how things are metabolized potentially, and looking at their lifestyle habits and the fact that many women who I've spoke with, they do tend to prioritize other family members and friends and work over their own needs, and just to help them to reprioritize their life.
Okay, thank you.
Mhm.
Any other comments or questions? Okay, thanks everyone. Great discussion. We're going to turn things back to Claire for a moment here.
Sure. So just a reminder, the spring echo clinic registration is open. We are hoping to close this week. So if you are interested or know someone that's interested, I do encourage you to apply. We only have a couple more spots left. Rick, next slide. And then your post-clinic survey should have just been emailed to you 30 seconds ago. So if you could fill that out, we appreciate it. Next week is our final week of clinic for the fall. So we will see you all then.
Thanks everyone. Take care. Have a good week.